Hello, everyone, and welcome to the Anti-Doping Podcast, brought to you by the Partnership for Clean Competition. I'm your host, Dr. Marie McNeely, and today we are joined by our guest, Dr. Neil Robinson. Listeners, Neil is head of the Science and Medical Department at the International Testing Agency, or ITA. And today we're looking forward to talking more about his career, the important work that he and the team at ITA are doing, and specifically some of their work on anti-doping sample storage and reanalysis. So, Neil, welcome to the show today. How are you?
Fine. What about you?
I'm doing quite well, and I'm excited to chat more about you and the work that you're doing. And perhaps we'll start by talking about you. So can you tell us more about yourself and how you got interested in research to begin with?
So I was born in Switzerland and raised in Lausanne. I did my studies at the University of Lausanne, and I specialized in biochemistry and pharmacology. And while I had the chance to begin with a PhD in microbiology, I bumped into a friend of mine and she recommended me, let's go and meet Dr. Soji. He was the deputy director of the Swiss Laboratory for Doping Analysis. And this excited me. Anti-doping was quite exciting for me. So I said, okay, let's go and meet Dr. Soji. And what I really appreciated when we had this initial meeting is anti-doping is a bit the Swiss knife. You are dealing with, of course, clinical chemistry. You're dealing with sports. You're dealing with law. You're dealing with investigations. And I like this very much. So I dumped my initial plans to do a PhD in microbiology, and I decided to do a master thesis first in anti-doping. And it was a quite interesting period because France was preparing for the World Cup, and there was a few positive cases for nandrolone metabolites, and everyone was getting extremely nervous. And the FIFA said, okay, we need to fix this. And they asked the Swiss Laboratory for Doping Analysis to conduct a research. And this was my master thesis. And I was super excited because we figured out that there were some issues with nandrolone. It was not that easy because there were some positive cases which couldn't be attributed to contamination or doping. So there was something going on with nandrolone metabolites. And over the years, we see that WADA put in place some very specific technical documents because, for example, pregnant women have nandrolone metabolites. If you take some contraceptive pills, also, you find nandrolone metabolites. So it was a really fascinating period. During that period, there was also a big scandal in France during the Tour de France 1998. They discovered that there was a medical doping practice in some cycling teams. And that's when I finished my master thesis, and my professor at the time said, okay, you should do a PhD and do a PhD about blood doping. And that's when I began my PhD at the Swiss Laboratory for Doping Analysis, and it was mainly focused on blood doping. So blood doping was mainly focusing on EPO and blood transfusion. This was quite challenging. We had a very good team working in Australia preparing the Sydney Games. And it was not a fight, but it was challenging because they were also working on the same topic. And finally, at the end, the Lausanne model was adopted. And the ABP, or the Athlete Biological Passport module, was then integrated in the fight against doping and later on included in ADAMS. It was a very interesting period because the French laboratory in Paris had set up a new method to detect EPO in urine samples. And immediately we implemented this method in Lausanne, and we were the first laboratory to have an adverse analytical finding. And it was not easy, as you can imagine, because it was a new method, a new approach, and people were criticizing the approach we had put in place. But we managed to really have a new method to fight against doping. And I think that was a game changer. And then I had also some other activities, and UCI wanted to prevent athletes from doping. And they had set up this no start rule. That means athletes with an elevated hematocrit could not take part to the cycling event. We were doing lots of tests since 1996. And the interesting thing, I was in the Vuelta 2003. And while I was analyzing the blood samples, I saw some atypical observations. And coming back to Lausanne, I went to see Dr. Soji and I said, something is going wrong. I said, transfusion is back. And I remember Dr. Soji saying, do everything you can. You need to fix the problem. This was a fascinating period because we had to go very quickly. Everyone was nervous about blood transfusion. So I went to the main hospital and I hired someone. And this person was extremely dedicated and he worked really hard to integrate the method in-house, to validate and have it fully approved by WADA. And in 2004, we had the first homologous blood transfusion case. This was Tyler Hamilton. It was quite an interesting case because it was, again, a new method and it was a very high-profile athlete. So that's exactly what brought me in anti-doping. Then, of course, I worked in the lab for 20 years and I did lots of, let's say, routine work. I was in charge of the EPO method, the blood transfusion, the ABP program. And after a while, I decided to change career.
Well, Neil, it sounds like you entered the field during a really dynamic time and got to work on some really exciting projects over the course of your career. I'm curious, though, why did you decide to make a change and what brought you ultimately to ITA?
So I had a wonderful time in the lab. I was free to do many things and I really had the support of my colleagues. It was really fun. But after a while, you get a bit tired and I think you need to step back and maybe leave the chance to other people. And suddenly I saw a position at the IOC and I said, why not change and see the problem from a different angle, not from the laboratory angle, but from the testing authority angle. And I joined the IOC. And it was also a very interesting period. I joined in November 2016, and I was asked to take care of what we would call the Russian scandal, which was mainly samples being manipulated during the Sochi Winter Games, where the FSB, so the former KGB, they managed to open the samples and swap the urine during the games. That means that the Moscow laboratory in place during the games were reporting negative samples, while probably most of the Russian athletes at the time were taking illegal substances. So this was a very interesting period, also quite stressful because the IOC wanted to make sure that none of these athletes would take part to the Pyeongchang Games. I was also in charge of reviewing the research projects because IOC was putting quite a lot of money into research. And I was just making sure that these timelines were respected and the money was allocated to the right projects. I had also some spare time, I would say in brackets. And the idea was to work with my colleagues at the IOC and also external partners was to set up the ITA because IOC had understood that there was a necessity to outsource anti-doping and to have it taken care by an independent organization. So we were building up the basics of the ITA.
Very interesting. So can you go into a little bit more detail, Neil, about ITA and just the important role that it plays right now in the global anti-doping community?
As I mentioned, the idea of having an independent organization was based following the scandal in Sochi. The WADA, IOC, and also the federations, they realized that there was a need to have an independent body taking care of their anti-doping program. So the ITA began in July 2018, and there was some staff already involved during the Pyeongchang Games in the beginning of 2018. But we grew up from a small team of 8, 9, and now we are the largest anti-doping organization. We are more than 130. We have 2 offices. We have the HQ in Lausanne, and we have also a European office in Budapest. And we are in charge of the anti-doping program for more than 80 partners. We collaborate a lot with, of course, the World Anti-Doping Agency, national anti-doping organizations, universities, public and law enforcement authorities. Today, we collect more than 40,000 samples per year. And these samples, they belong to more than 15,000 athletes, belonging to over more than 200 countries. So you see, it's quite an important program. We work with different athlete passport management units we call APMUs. And these number of samples, they generate a certain amount of notifications, as we say, and we take care of more than 44,000 notifications per year. And also we are in charge of the largest TUE program, so therapeutic use exemption. Athletes are allowed to request for a therapeutic use exemption if they are injured or if they are ill. And we take care of more than 1,000 of these TUEs per year.
Well, Neil, I think this growth that you highlighted is just remarkable, starting in 2018 and coming to this picture that you described of what it looks like today. And we mentioned earlier in our introduction that you're head of the science and medical department there at the ITA. So what do you do in your current role? And maybe can you talk a little bit about the scope of the research and the development work that you and the team are doing there?
So the science and medical team is a pretty large department. So we are now 16 employees. 13 are in Lausanne and 3 are in Budapest. And our core responsibility is mainly, first of all, to design the risk assessment and test distribution planning. As I mentioned before, the therapeutic use exemptions, where we get the documents from the athletes, we anonymize these documents, and then we submit them to an independent panel of experts. We try to avoid, for example, if it's a Swiss athlete, to send the documents to a Swiss expert. We try also to find the right experts. I mean, if we're dealing with a muscle injury, we will not send this document to a normal GP. We will send it to a specialist. We are also in charge of the athlete biological passport, as I mentioned before, where we monitor, we do the analysis of all these passports. And one important program we have is to take care of the long-term storage of samples collected on our behalf. These samples are collected, they are sent to WADA accredited labs, they are analyzed, and then they are stored in the WADA accredited labs for a period of 3 months for urine samples. And some of these samples are flagged by our testing officers. These samples are then stored for an extended period of time of 10 years. And the same applies also for blood samples and for dry blood spots. Also, an important task we do at the Science and Medical Department is we support our legal department. So when there's an ADRV or an AF, they come to us and they ask us for support to understand if the documentation packages the laboratory produces are fine, and they try to challenge us, or we challenge them to make sure we have the right strategy when going to court. The department is split into 3 units. One unit, as I mentioned, for the TUEs, one is for the ABP, and we have a very strong unit of 5 people taking care of data analytics. And they really support us because we think we must be a data-driven company where we concatenate lots of data from performances, from whereabouts, from testing figures, from various sources, and we include them together to bring a strong and robust risk assessment. And we also use this information for our long-term storage project. We also work with different universities and different academic centers where we try and work together with these independent organizations to improve our knowledge and to improve the way we conduct our testing. One of them is, for example, with the Paris WADA accredited laboratory. We are challenging the fast turnaround time during the games. The samples are delivered to the laboratory and analyzed as quickly as possible. But we're trying to understand if this is really worth it, because it has a cost. Everything you do quickly has a cost. Should we continue this way? Is it the right way? Can we improve? Can we do things differently? We are also working with the Oxford University on different biomarkers. And we're trying to identify if there are new markers we could include in the biological passport. With the Dresden WADA accredited laboratory, we're working on a microvolumetric testing approach. Can we collect blood or can we collect samples in a different manner to avoid hurting the athlete or, let's say, being less invasive? With University College London and University of Kent, we're working a lot on the performance passport. We believe there's a way to extract the data from the performances and identify those athletes who are potentially manipulating. And this is really working very well. And for some sports like aquatics and weightlifting, we have included this in our daily work. With the University of Queensland in Australia, we're working on a detailed analysis of the TUE data because we think there are some aspects we could improve. Also, with 2 other WADA labs, one is the Rio WADA accredited laboratory and the Lausanne WADA accredited laboratory, we are working on the impact of long-term storage on the steroid profile to understand if all these metabolites, if all these compounds are robust enough not to generate some wrong steroid profiles after 10 years of storage. We are also working with the University of Lausanne on sources of contamination and how to tackle this problematic. And finally, it looks a lot. We're working with the Zybersdorf laboratory and the impact of some bacteria species on the steroid profile. So it's quite active, as you can see, but we're not doing the work alone. We're really relying and we're supporting these different university laboratories or water accredited laboratories.
Oh, very cool. Well, Neil, it sounds like you have quite a range of different research and development projects going on right now. And I think there's just so much to do in the anti-doping world because things are always changing so quickly. So what are some of ITA's key scientific and medical priorities right now at the moment?
I think the most important topic we're working on, it's a long-term project. It's the issue with contamination. Why is it so important today? I think there are different reasons for that. First of all is the analytical tools are extremely sensitive today. Are they too sensitive or not? That's another discussion. But I think we are seeing things we couldn't see 10, 15 years ago. The other thing is maybe more products are contaminated than expected. One thing we observe is you can buy some painkillers and these painkillers are contaminated with different compounds. I mean, they can be diuretics, they can be hormonal modulators. And we need to understand what is the impact of these contaminants on adverse analytical findings reported by water accredited laboratories. So we're working with the University of Law and especially the Faculty of Law and the School of Criminal Justice. And the idea is to tackle this contamination issue from different angles. One is from the legal aspects. The other is from the, let's say, scientific aspects. And I hope in the next 2 to 5 years, we will come up with a proposal which will be supported, let's hope, by the anti-doping community. We're also working on different aspects of the data we gather from our team from the data analytics and to better understand some problems we see and how to improve. I will give you an example is all the logistic aspects. We see that there are ways to improve the stability of samples, maybe to improve the way we ship samples. And that can be done because now we have lots of data and we can go back to the data and analyze them with more details. We are also focusing in-house to do a lot of automation. There's lots of tasks we're doing daily, which are time-consuming, which can be considered as boring. And we are trying to improve this to be more efficient and to deliver our partners with the best service without increasing costs. I think we must make sure that we offer the best and the most suitable services to our partners.
Absolutely. And I think, Neil, you brought up so many different important areas in anti-doping in these recent questions that I asked that I'd love to dive into all of them, but we'll maybe focus today starting with the sample storage and reanalysis. I think this is a really important area of anti-doping and has a lot of potential to change how athletes are responding to anti-doping programs. So can you talk a little bit more about ITA's efforts in this area?
The long-term storage program started in 2004, and this was a IOC initiative. And since then, they stored all samples for 10 years. Then they put in place a reanalysis program, which was very effective. And you probably heard about the Beijing and especially London reanalysis campaigns, where there were a lot of adverse analytical findings. When I joined the ITA in 2018, we had a long-term storage strategy, but which was quite small because we had just started. And in 2019 in Katowice, President Bach, president of the IOC, he announced that he would support financially the storage of all samples collected on behalf of international federations and NADOs of athletes potentially attending the Tokyo Games. So this was a big challenge for us because we knew that we had to take care of all these samples. And there were different options. The first option would be to store samples in water accredited labs. The other one was to rely on big biobanks the pharmaceutical industry has. And the third option was to create our own facility. And we went through all these different scenarios, and independence is part of our DNA. We suggested the IOC to build our own facility. And I think over the years, it demonstrated to be the right strategy WADA accredited labs, they have an accreditation which can be revoked if they don't fulfill certain criteria. And samples stored in these facilities are challenged because you need to take care of them. So you need to go to the laboratory and remove them. And then you need space to store them. So by chance, we had built a facility which is based here in Lausanne and store these samples, and we could take them away from WADA accredited labs in case they lost their accreditation. So we had to build this facility. We had to do the ISO accreditation. We had a visit from WADA. And this was quite challenging because you remember in 2020, we had COVID. So it was not that easy.
Right.
But by chance, in some ways for us, the games were postponed. So we had a bit more time to handle and take care of all these aspects. We had to build some quite sophisticated IT solution because when you ship all these samples all over the place, you need to know where they are located and where to find them. And it was very interesting. And now it's working pretty well. A lot of people didn't like this approach because they believed they were losing business. And then I'm talking about the anti-doping labs. And some labs were very happy because, as you can imagine, some labs are located, as an example, in the middle of London. And it's very complex for them to store samples for such a long time. And they were very happy that there was an alternative solution. So since then, we are piling up samples. I think we have more than 65,000 samples, and it's continuing. We are going to repatriate the samples from Milano Cortina in the coming days. And I think it has been quite successful.
Absolutely. And can you maybe comment on, is storage capacity something you're thinking about at this point, or is there plenty of room at the moment?
We have capacity, I think, for 700 square meters. So it's massive. For the time being, we're using 100 square meters, and we were going to build our second code room this year. So we're doing one by one. The idea was not to build a huge facility because, as you can imagine, if the huge facility is empty, it costs a lot of money. So we started small and we are going one by one, and we have capacity up to 700 square meters. So it's a few million samples. So I think we are safe for the next 10 years.
I think that's remarkable. And you mentioned earlier that you're storing urine, blood, dried blood spots. And are all of the samples that you're storing going to be held for 10 years?
Technically, these 10 years, it's defined by WADA, so we can't keep them for longer. But some samples have already been reanalyzed. Samples, for example, collected during the Paris Games, they were brought back to our facility, and then suddenly there's an investigation going on. Or there's a recommendation by an APMU, oh, please go back to this sample and perform this specific analysis. We're not keeping the samples for 9 years, then analyzing everything and then discarding the samples. It's a process, and it's quite active the first year when the samples arrive. Then it cools down. And then I would say 7 or 9 years before they are discarded, it gets pretty active.
Certainly. And can a sample be reanalyzed multiple times over the year? So say new testing methods or analysis methods are developed. Is this something where you can pull that same sample out again, or do you only have one chance for reanalysis?
There are two limiting factors. One of them is, of course, the sample volume. If you don't have any volume left, if you don't have urine left, if you don't have blood left, you can't do anything. And the other thing, of course, is the stability of the analytes. If they are susceptible to degrade after freezing and thawing cycles, then we will not reanalyze for this specific drug multiple times.
Oh, that makes sense. And you mentioned that you're not retesting absolutely everything during that 10-year period. Can you give us an example of a situation that may prompt reanalysis of one of these samples that's being held in storage?
There are multiple reasons why we are asked to do some reanalysis. Already the terminology, we have to be careful. We make two distinctions. One is reanalysis. So we apply the same method as applied during the initial testing. As an example, we look for stimulants, narcotics, anabolic agents. And there's a further analysis where we add analysis which was not in place at the time of sample collection. Let's say suddenly a laboratory discovers a new method to detect whatever doping practice that we would consider as a further analysis. So we are asked quite regularly to go back to the long-term storage to do a further analysis. As an example, we include EPO analysis on a specific sample because EPO is not a mandatory method on the sample at the time of sample collection. It's on demand. So some samples are collected. We know to perform EPO analysis because it's quite expensive. It's quite time consuming, and also it requires a certain amount of sample volume. But sometimes the APMU may say, okay, this sample we would like, or we'd appreciate if you could reanalyze or you could perform EPO analysis. There are also some investigations. Maybe some athletes are flagged because they have been, let's say, involved in some doping practices, or they bought some prohibited substances on the internet or whatever. They had some atypical performance data. And then we go back to the storage facility. We withdraw the samples and we send them to the laboratory for further analysis or reanalysis. There's also the atypical profiles. Some samples, suddenly the APMU says, okay, I would like this sample to go through a full RMS analysis because we believe there's some maybe an intake of testosterone or other drugs. So we do this. Interestingly, and this is especially the case for Olympic samples. Olympic samples are collected in the village mostly or during the venues. And we believe sample swapping is extremely complex because there are chaperones. Everything is done in a very structured and organized way. Now, when it comes to out-of-comp testing, we don't know always what happens between the DCO, the BCO, and the athlete. Is there some corruption? Is there some manipulation? And this can happen. So we go back to these reference samples, we say, and we compare the DNA profile of these reference samples to the questionable sample. And we've been very successful these last years with identifying a few athletes swapping their samples during the out-of-comp testing. Also, we reanalyze samples when there's a medal reallocation. If an athlete is on the podium, he gets a medal, and then 10 years later, let's say we discover that he was doped, his medal is removed, but then we reallocate every medal. The silver medal becomes a gold medal, the bronze becomes silver, and then the fourth person who would reach the podium, we would reanalyze the sample before he gets his bronze medal. And then finally, we also reanalyze just a year before the samples are discarded. We do some campaigns where we reanalyze a lot of samples. And the idea is to understand, I wouldn't say the prevalence, because the prevalence, we should maybe analyze even more samples, but enables us to make sure that we've done our best and our due diligence to make sure that the athletes who would have a reallocation of a medal, they're clean, and we've done our best with the samples.
So Neil, can you comment on whether this massive amount of samples that are in storage, are they all going to be reanalyzed at some point, or are some of them just sort of stored and then eventually discarded?
All sample stalls will not be reanalyzed. They are kept for up to 10 years, but depending on the necessity to reanalyze the sample, we will analyze them maybe a year, 2 years later, based on intelligence, based on information we have from different partners.
Well, Neil, I think this is absolutely fascinating. And you hinted earlier at just some of the challenges that you may encounter in storing and reanalyzing or doing further analysis on these anti-doping samples, things like limited volume, things like stability. Are there any other challenges that you encounter in this process?
We have to be fair. The logistic aspects are quite challenging, and we faced two crises. The first crisis, as I mentioned before, was COVID-19. It was very difficult to ship samples. It was very complex. It was also expensive. Now, of course, we have another crisis in the Middle East where energy prices increase significantly. And this has an impact on the storage cost because we have a flat fee. And in this flat fee, of course, we include the shipment fees. So this has an impact on our daily activities. The other challenging thing is once we want to reanalyze the sample, we don't really know what the laboratories do. So during the initial testing procedure, the laboratory will report this sample is negative or positive, or there's an AF for a certain substance. But when it's negative, we don't really know negative to what. And we don't know how many metabolites were screened. We don't know what was the limit of detection, what was the limit of quantification. And that makes our lives pretty complex. If 9 years later we need to reanalyze the sample, we would need to have this information because maybe we're wasting resources. If the limit of detection hasn't changed within 9 years, what's the point in reanalyzing the sample for this specific method? So this is something we are working together with WADA and the WADA Accredited Labs is to have a bit of a more of a exchange of information, a better structured information so that we have this information from the beginning and we can do the best we can with the samples we have.
Well, that makes sense. And you briefly mentioned just this idea of doping prevalence earlier. How has implementation of sample storage and the potential for reanalysis or further analysis impacted how we estimate doping prevalence?
I've worked on prevalence studies in the past, and there were different ways of doing it. There was a technique using questionnaires, and that was taken care by WADA. And we were working with track and field, and we were estimating the prevalence of doping based on biological variables. And that's how we managed to figure out that there was a big, big doping problem in Russia, not to mention in other areas of the world. This is a good way to do it because you screen every athlete and you have reference values and you compare your population of interest based on these reference values. When it comes to anti-doping analysis, as I mentioned before, it's negative. But negative to what? That's the difficult one. And it doesn't mean the athlete didn't dope. It maybe means that the method was not appropriate, not sensitive enough. Or maybe the athlete doped a long time ago. Maybe we didn't collect the right sample type. That means it's a difficult question. I don't think the reanalysis really provides a good estimate of the prevalence. Maybe for a stimulant, you could do so because you have the athlete in front of you. He, let's say, runs 100 meters. You collect a blood sample immediately after he reaches the end line and you analyze the blood and you say, okay, this athlete was under the influence of a stimulant, yes or no. Now, when you go to urine, you don't have this answer because there's always a delay. And he either took the stimulant before the race or he had maybe a long time before the race. So I think we have to be very careful about estimating the prevalence of doping using urine samples. This is something pretty tricky here.
Definitely. And I think just this idea of making sure that you're collecting the right sample from the right athlete at the right time is an incredibly complicated process. There's going to be gaps, there's going to be holes, but how does ITA use these prevalence estimates to try to inform testing efforts and develop evidence-based testing strategies that are more likely to succeed?
We would love to have a technique which would enable us to go through these prevalence studies and then to allocate the resources we have for the right population of interest. I'll give you an example, combat sports. Maybe there's a problem in certain areas, but not in others. For the timing, we're considering combat sport as a sport, but maybe we shouldn't test in the US as an example or in Europe and allocate this money in other parts of the world. Or the opposite, maybe the problem is in the US or in Europe, I don't know. And that's the reason we would like to have a tool to understand the prevalence, whether it's linked to some sports, some disciplines, some countries, some gender. Maybe there's an issue in female cycling or in male cycling. So you see, this is extremely important because then we can do the best with the resources we have. So currently we don't have a tool. We are thinking of implementing this. But it takes a bit of time. It takes a bit of negotiation with our partners. And also you must make sure that the tools you are using are robust and they will not cause chaos. I will give you an example. Currently, there's about 1% of AAFs. Let's say we open the Pandora box and we do a prevalence estimate and we have 10%. What does it mean? That we were not good? Or are they using drugs which are undetectable? Are the labs not good? Are they taking drugs which are not totally approved by our medical authorities or the FDA, whatever? So we also have to anticipate what we will do if the prevalence studies are showing something very different to what we have in terms of AFs reported by the laboratories. But currently, there's no real tool which can be used as such. So we are working together with our partners to try and find a solution for that.
Absolutely. And I think it's just a difficult challenge because as we kind of highlighted earlier, there just are limited resources. You can't test everybody at every competition or even leading up to every competition. So I guess what information do you use then to try to make sure that, again, you're collecting the right sample from the right athlete at that critical moment when you are most likely to catch them doping if you don't necessarily have right now these prevalence-based tools that you can use?
We use multiple tools now. We call it the battleship. If you can imagine, there's a kind of a calendar in front of your eyes, and we see where this athlete is competing. And these represents the boats. And we see when we perform a test, whether we are before competition, during competition, and after competition. There are some critical periods. There's the lead up to an event. And there's also after the event, which is also important because there's the recovery because the athlete wants to take part in another event. So we have these kind of maps and we're looking when is the most optimal time. But again, the optimal timing is also molecule dependent. If you take a stimulant, what I've told you, it doesn't work. You should consider the event. Testing before is more the drugs you use, like long-term acting drugs like anabolic agents. We have blood transfusion. We have EPO. So you see, we use these tools to facilitate our work. And the interesting thing is using this battleship, we see there are some gaps. There are some gaps and we're trying to fill the gaps and make sure what we're doing today is not what we did yesterday and not what we'll be doing tomorrow.
Well, that makes sense. I think adapting and being aware of where the limitations are can be tremendously helpful. And we mentioned earlier that your department is kind of split into these three areas that are focusing on different priorities. You've got the TUEs, you've got the athlete biological passport team, but also the specific branch focused on data analytics. And I think this is a tremendously important area of anti-doping. So can you talk a little bit more about how the anti-doping community can perhaps better leverage just this large volume of data that have already been collected to continue to enhance clean sport and make these decisions easier for you in terms of where to allocate resources?
This is quite a challenge. So today, most of the data are in the hands of WADA and WADA accredited laboratories. We have options to extract data from ADAMS, which is the tool WADA provides to concentrate the data from the testing authorities and from the WADA accredited labs. But still, the raw data are quite interesting. The laboratories are sitting on a lot of data, and in my mind, they belong to the testing authority, these data. They're hosted by the WADA accredited labs, but they belong to the testing authorities. And why am I saying that? Is there's a way to reanalyze samples by doing what they call digital matrix reanalysis, is you go back to the raw data and you run the data once again, and you can figure out if there's a specific metabolite which was undetectable 10 years ago, but could be detected today just by computing these data once again. And my personal feeling is we should work more hand by hand with the laboratories that they give us access to the data. So today we don't have access, but I think there's a way to improve that and to use these huge data sets and improve the fight against doping. There's also lots of data available on the internet. I mentioned before the performance passport, a lot of data are available and we just need to extract them, to use them as they are, and to do some deep analysis. There's also, of course, data from social media and location. As an example, the athletes have to declare their whereabouts. And they say, for example, I'm spending my vacation on this island. And then on the social media, you see pictures of the same athletes in London or New York. So there's a discrepancy here between the declaration of the whereabouts in ADAMS and the reality of the athlete. So I think there's a lot of potential of using this data and combining them to find the way we want to enhance clean sports.
That's really interesting. And I think you brought up a great point that the instruments are getting better, but also computationally, we just have better, stronger tools and more different models. And I think artificial intelligence is providing a lot of other avenues to pursue as well.
Exactly. I think this is the way to do, because technically, once you have the data, there's no cost. I mean, there's, of course, a bit of cost.
Yeah, right.
It's not like reanalyzing sample where it has a cost. You have to ship the sample. You have to go through a full procedure. This has a real cost. Computing data, if you have the right APIs, the right connection, it doesn't cost much.
Well, that makes sense. And I know we talked about these different services that you offer and the research that ITA is doing, but you're also developing some really valuable resources. So I'd love to talk about this as well. So can you share, Neil, how ITA is developing these resources and how you're promoting scientific knowledge and anti-doping research and just these innovations in scientific approaches?
We try to publish some of the data, but again, we are not an academic center, so this is not our core business. We mainly focus on our routine work. We develop protocols, procedures, and once we have done that, we try to use the data we have, and in collaboration with universities, we publish some of the findings. We disseminate also this information thanks to the different symposiums, conferences, workshops, and that's another way we share the information. By the way, we are organizing an event in a month's time. It's the first event. It's called the Clean Sports in Action, and We're using this event also to understand what are the needs of the partners we collaborate with, because I think we need to listen to the laboratories, the logistic companies, and also we need to share the problems we are facing. And I think this will be the first event where we are putting all these people around the table and saying, okay, how can we fix them? We should not just say there's a problem. We need to fix them. And I think that's a good approach. But of course, as a scientist, the thing I really appreciate is to publish the data in a peer-reviewed papers, because this gives credibility to the work we do.
Absolutely. I think that's important. And I think throughout our conversation, we've highlighted some of the amazing collaborations that ITA has. Can you maybe go into a little bit more detail about just the broad range of stakeholders that ITA collaborates with, including funding organizations like the PCC, these anti-doping laboratories, universities, and others?
Unfortunately, we don't have a research budget for the time being. We are doing some research with the support of universities, with the support of different academic centers. And that's, I think, will be the next step, is to look for some funding from different stakeholders. And you mentioned PCC is one of them. Of course, they have a very good system to grant some support for research projects. And I think that will be one of the priorities in the coming years. There's also WADA. But what I really believe is also the support from the industry. To partner with the industry is something very important. They have huge amount of knowledge, and also they have the right connections. They know, for example, this and this laboratory, maybe in South America, maybe in Africa, they are doing the research, and they could put us together and we could work together on the same topic. And probably, and I hope, the industry will also support some of the research. So that's the way I think we should support the fight against doping. There's not enough money coming from WADA. Even PCC, if you share this whole amount of money with the different labs, it's not enough. We need to go further. But as you can imagine, we have to make sure that we're totally independent and not bound to the industry. And we're not biased when taking decisions or when publishing results. We have to find the right balance between the financial, technical support and the independence.
Certainly. And Neil, I'm really glad you mentioned that, because I think those are really important considerations when you're thinking about where the money is coming from and what any restrictions or limitations would be in terms of how that impacts the science. So I appreciate you sharing that. And we've talked about some of your different experiences over the course of our conversation today. And I'd love to talk about just how the anti-doping scene has changed during the course of your career. What are some of the key evolutions that you've seen or key advances that you have seen happen?
I'll talk especially about Switzerland because I know Switzerland, but I think it's the same problem in Germany, in France, in Europe. Maybe in the US it's slightly different, but scientific research is becoming increasingly complex. The regulatory framework, there's more and more administrative work, and this has a cost. And this is the reason if you get, let's say, $100,000 to conduct a study, a lot of this money just goes into paperwork. And that's really challenging. It was much easier some years ago. Did we do things properly? I suppose so. But now it's getting really complex. You need to go through ethics approval, what we also did 20 years ago, but it was much easier. And where I'm afraid there will be some research conducted in countries where this administrative work is less important, but then maybe we're putting at risk some subjects, or it will not be done in our countries. So we need to find again the right balance I was mentioning before, that we don't overdo things because the paperwork is very complex. In the last decade, I think we see that there has been some major improvements in the fight against doping. One of them, because it was in 2000, it was the EPO direct detection I mentioned also before. This was a game changer. And then we had the homologous blood transfusion. Blood detection was also very, very important because we were fighting two things there. We were fighting against doping, but I think we were also making sure that athletes were not putting their lives at risk. Then, of course, the athlete biological helped a lot. And we mentioned that the estimation of prevalence in 2010 showed that there were some problems in some specific areas. Unfortunately, what was done at the time cannot be done again because there's a need to revalidate the data and it's a lot of money, a lot of resources. But since then, there hasn't been a big change. And I think that's a pity because there have been, of course, some improvements, but I don't see a major change since 2010, 2015. Maybe some people may be upset listening to that, but I think that's the reality. I think we should use maybe this large data set we mentioned before, because we have the capacity now with AI, machine learning to use the data in a clever way and improve the way we tackle anti-doping.
Certainly. And perhaps the next big change is on the horizon, Neil, right?
Yeah.
We have to stay positive. Well, can you tell me, I know we have a lot of problems in anti-doping that remain. And oftentimes, as we've mentioned over and over again, resources, funding, staff, all these things are limitations. So if we took away the barriers that normally hold you back and you had all of the resources you could dream of, what is the one problem in anti-doping that you would most want to solve, Neil?
I would like to know who's doping. Because if you go to a party and you talk to people, the layman, they all say they're all doped. To be honest, I don't think so. Now, the thing is, how many are doping in the event or whatever? And this, I don't have the answer. And sometimes I think to myself, we should know, because maybe if it's 1%, what is currently detected by the labs, can we live with that? Maybe we could stop anti-doping. Is it 15%? And if there was not such a strong program in place, it would be a disaster. But it's still something I'm wondering, how many of the athletes are doping? And is it across all disciplines, all sports? This is something which is quite interesting to understand. Are we improving over the years? Are we getting worse? Are they taking drugs we can't detect? This is something, without any hesitation, I would like to know how many athletes are doping.
Absolutely. And I think this is one of the particular challenges with the field of anti-doping is we sort of lack this fundamental information about the nature of the problem that we're all trying to solve. So I think this is certainly a conundrum, but we appreciate you sharing your insights and giving us a lot to think about in the anti-doping space. But if our listeners want to learn even more, Neil, what is the best way for them to get more information about you and what's going on at the ITA?
I like talking to people, but I don't have any social media. I try to protect my personal life. So this is going to be quite a challenge. Mm-hmm. When it comes to ITA, I'm very happy to welcome people here at the ITA in Lausanne. I'm more than happy to take a break, have a coffee, and to discuss. And I like to be challenged what I do, what the company does. It's very important. I think no one is right. No one is wrong. There's probably something in between. Now, if people want to know a bit more about the ITA, I strongly recommend that they go on our website, and it's www.ita.sport. And then you have access to what we do, and you have access also to our social media links. And I think that's the best way to understand how the company is structured, what we're doing, who's involved, who's our president, who's our director general. Everything is there.
Excellent. Well, listeners, definitely take some time to browse ITA's website to learn more about the organization and the great work that they're doing. And Neil, thank you so much for chatting with us today and sharing your insights and expertise.
Thank you very much. It was really nice talking to you. And I hope everyone will appreciate what I just said about the ITA and the anti-doping work we do here.
Wonderful. Well, we appreciate your time, listeners. It's been great to have you here with us as well. If you haven't already, it would mean so much to us if you could take a moment to rate the podcast and leave a review on your favorite podcast platform. Make sure you subscribe. And listeners, please note that the Anti-Doping Podcast features a wide variety of clean sport experts, and episodes may include statements and or viewpoints that do not necessarily reflect the views or values of the PCC. Thank you, and we look forward to seeing you on the next episode of the Anti-Doping Podcast.